Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor, and we're here again on Monday for one of our live Q&A sessions. This is a chance for you guys to ask me any questions you want live in the chat, so please feel free to put them in there. And this is also a chance for me to answer any of the questions that you guys have submitted onto the channel. Please remember, we're also on social media, so you can check us out. Those will be linked into the description below. Please like and subscribe to the channel. Subscribing to the channel really helps me out as a content creator, so I really appreciate your support in that respect. And for those of you who stay until the end, we are back with new videos, and I will give you a sneak peek at tomorrow's video that will be posted. So if you want to be notified when those videos come out, remember when you're subscribing to also hit that notification bell. Remember, any of you, please share the channel because it really, again, helps me out. And we have a lot of great questions this week. And so I'm going to go ahead and get started. But remember, you can put any of your questions into the chat. So I'm going to start with a question about bleeding. We get a lot of bleeding questions. I think they're very one of the biggest topics that people get very worried about. So it says, it's been 2 days since I missed my period. I've been experiencing various pregnancy symptoms, but I am bleeding now. Please kindly guide me. So first trimester bleeding is extremely common. It's just so incredibly common, and yet it's extremely scary. And there's a wide variety of reasons why you can bleed during the first trimester. For starters, you can bleed simply because you're still having a regular menstrual cycle. Like a lot of women still get their first period, which is why many women won't find out they're actually pregnant until they're 6 or 8 weeks along, because the first month, that third or fourth week of pregnancy, they actually had a period. The period is sometimes just different in its characteristics. You can also get you can get bleeding because of sex, because the vaginal walls and the vaginal tissue are very, very thin due to the hormones that are normal for pregnancy. So it dries it out, and that can actually cause some bleeding. You can have bleeding coming from actually the rectum, from hemorrhoids and stuff like that. So what do you do when you're bleeding? We have a video that we can link into the description that talks about what should you be doing. You first need to get it checked out. And if you are only 3 to 5 weeks pregnant, your healthcare provider may not see you in their office. So that means you have to present to an emergency room. And so there are many things that you can ask them to do. The two biggest things in the first trimester is, one, to get an ultrasound. An ultrasound is going to be able to look to see what's going on inside. Do we see a sac? Do we see a baby? Do we see a heartbeat? Do we see any kind of cause for the bleeding? The next thing is we can get a blood test for HCG levels. HCG is human chorionic gonadotropin. This is the same hormone that we test in a home pregnancy kit when you urinate on a stick. However, that particular test, it doesn't actually test at home the level of your hormones. But when we do a blood test, we can actually get a number. That number should be rising every 72 hours by a certain amount. So what we usually do is do the blood test, and then 3 days later, we have you come back and do it again. And based on those levels, we can tell you whether we think the pregnancy is going well or not so well. Now, going into our next set of questions, there's a couple things that we look for that could be the cause of bleeding internally. And so one of the most common causes is actually something called a subchorionic hemorrhage. So we have a video on subchorionic hemorrhages, and I'm going to explain a little bit about what that is. But we actually had 3 different questions on that video. So let's start with, I am 9 weeks pregnant, and I was diagnosed with a subchorionic hemorrhage at 6 weeks. I had heavy bleeding with clots. Thankfully, my baby is fine, but I've been experiencing brown discharge on and off with some cramping. It's at 4 milliliters. I think she means millimeters discharge. Does that mean it's resolving? I have a cervical length of 3.7. So this is a great way to start. So a subchorionic hemorrhage, for starters, let's talk about what it is. So you have your uterus, and you have your placenta. And this part of the placenta is a whole bunch of blood vessels, and this part of your uterine wall is where it's going to attach, right? And so what happens is when it attaches, it should be secure. And these two sets of blood vessels kind of intermingle to create the bed that feeds your baby and detoxifies, takes the toxins out of your baby. Well, sometimes you'll develop a little pocket of blood underneath. That's a subchorionic hemorrhage. It's basically a pocket of blood. And the way you can kind of think about it is imagine you bruise your arm. So when you bruise your arm, you get that black and blue underneath. That's where a whole bunch of blood vessels broke and you have a pooling of blood. And you know you have a pooling of blood because you see the bruise, the black and blue. Well, what happens over time? Over time, it actually gets smaller and smaller and smaller, and then it disappears. That's the same for most subchorionic hemorrhages. They start out and then they get smaller and smaller and smaller and disappear. Additionally, when your placenta starts, is teeny, teeny, tiny, right? So a subchorionic hemorrhage that takes up 50% of this teeny, teeny, tiny is huge. But that placenta gets bigger and bigger and bigger and bigger. So if the subchorionic hemorrhage stays the same size, it's actually in relationship to the size of the placenta getting smaller. Therefore, it's also resolving. So most subchorionic hemorrhages are actually diagnosed on ultrasound. Many are diagnosed, most that are diagnosed are asymptomatic. It's just found. It happens to be there. Subchorionic hemorrhages are also found when you see bleeding and heavy clots like this person did. Now, there's different colors of blood, and we have a video on that. But brown means old blood. It means there was bleeding that was active and now it's gone. And so brown blood from this person is probably left over from that subchorionic hemorrhage. And so that's why you see a little bit of that. Now, you always want to report changes to your bleeding to your healthcare provider, but most likely that's all this is a little bit of that. Now, over time, they will get smaller, but you can't actually say what's a normal size or not normal size. And that's a very common thing. People look at the numbers and they just want to know, is this the right size? Is this big? Is this small? It's changing all the time. So it's not something you can give a very clear answer to. Now, then she talked about her cervical length. And I think that this is extremely important to talk about as well, so you guys understand where some of this is coming from. So when we talk about cervical length, most of the time it's in reference to whether somebody has an incompetent cervix, which we have a video that talks about a treatment for that called a cerclage, or whether somebody's in preterm labor. So you have your uterus, and at the bottom is your cervix. And this is the opening to the uterus. It's between the uterus and the vagina. And a cervix should be long, thick, and closed, okay? Now, cervixes are never completely closed. This little slit right here is actually perfectly representing where the mucous membrane is. So the mucous membrane lines this little part of the opening so that no bacteria can come up and potentially cause a uterine infection. So 3.9 centimeters is generally a good length for a cervix, because really there's not a lot of room in your vagina. Your vagina can only have so long of a cervix. So 3.9 is actually pretty good. It does change. It can vary from person to person. So 3.9 for one person might be perfectly normal, and for another person might be shorter. It just really all depends. And so this is just one thing. I'm sorry, she said 3.7, but like this is one measurement that she was given when she was doing her ultrasound. So they will look at your cervical length, your placental position, and different things when they're doing the ultrasound, and you may see it on the report. To be very honest, this was a benign finding that really had nothing to do with the subchorionic hemorrhage, but it's fine and it's totally normal. Now, before I go on to the next questions, I see that Nancy's in the chat. Hi, Nancy. I'm 9 weeks pregnant, and I would like to know when I will feel the baby move. So this is a great question. Most of the time, you will feel the baby move between 12-ish, 12, 13 weeks to about 20 weeks, with the most common time being 15 to 16 weeks. Now, most women are actually probably feeling their babies a lot earlier than that. But the thing is that baby movements in the beginning, they're little teeny tiny movements that feel like gas. And yet you still also have gas. So it's really hard to say what's what. But in the very beginning, you can kind of feel like a flutter or a gas bubbly type of feeling. As the baby gets bigger and you start to feel the rhythm of that movement and the changes, you will start to realize what was gas and what was the baby. But at first, you can't tell, especially if it's your first pregnancy. For most moms who are then pregnant more than once, they are likely to feel the baby much sooner because they are then in tune with what that feeling was like. But generally speaking, it's about around 15 weeks for the first time mom. Now, if you don't feel the baby at 15 weeks, it doesn't mean the baby's not moving. It probably simply means that you're not able to quite figure out which is movement and which is not. The other thing is, as we were talking about placental position for that subchorionic hemorrhage. So your uterus, right? You have the uterus, but sometimes the placenta is anterior. So you have anterior, which is towards you guys, towards your belly button, and posterior, which is back towards the spine. If you have an anterior placenta like this, so the placenta is like a big, soft, squishy pillow. But if you have a big, soft, squishy pillow in the front of your belly, there's two things that happen. One, when your baby's kicking, they kick that pillow, which means you actually don't feel it as much because it's being absorbed by the placenta. And two, these are the babies that it's hard to find their heartbeat. So if you're going in every time to the OBGYN, and one of the things they like to do is they like to check the heartbeat, and they're always having trouble finding the heartbeat, ask them, do I have an anterior placenta? If you have an anterior placenta, that generally speaking means that what's been going on is that they're trying to get underneath the placenta so that they can hear your baby, which is a harder sound than your blood flow, which is a softer, swishy sound. Okay. And so that's oftentimes what's going on. So if that happens to any of you guys, you should ask them about that. Please feel free, anybody, you can put your questions into the chat like Nancy. So going with the subchorionic hemorrhage stuff, right? So one of them said, I have a 4 by 2 by 3 centimeter subchorionic clot. Now I have a 5.3 by 1.2 subchorionic clot. Am I in recovery or not? Please reply. So it's hard to say because if it's getting bigger, then maybe not. If it's getting smaller, but this is a new one, maybe not. It's very hard to say. You guys, when it comes to subchorionic hemorrhages and their measurements, this is not really something that I want you guys to focus on. It's hard because we want data. When something's going on, we want data because we want to try to fix that problem, right? But when you're talking about like these subchorionic hemorrhages, they change all the time. So the more important thing is, how is the baby doing and how are you doing? And as long as you and the baby are stable, it's fine. Now, the last one was, I had an internal bleeding detected on sonography at 9 weeks, also called a subchorionic hemorrhage. The baby is doing well, but I'm now worried because it says I have an irregular separation inside the gestational sac. Okay, so sometimes people confuse a subchorionic hemorrhage for a placental abruption. Okay, so a placental abruption is where the placenta detaches from the uterine wall. Okay, now it can happen right at the end of your pregnancy when you're like 40 weeks. It sometimes will happen while you're actually trying to deliver the baby. It sometimes happens before you come in to deliver, although that's an extreme rarity. The most common cause of a placental abruption before you're actually laboring and doing all that is somebody who's used cocaine or other drugs like that. However, early on, sometimes you'll get a partial placenta abruption. Placental abruptions are a medical emergency. Sorry, guys. It's a medical emergency because remember, this is all blood, right? Blood vessels, blood vessels. If this detaches, your baby is no longer getting food and you are now bleeding. Okay. Medical emergency for both of you. It's an emergency C-section. But when you're earlier on in your pregnancy, you will sometimes get a partial placental abruption. So instead of the whole thing coming off, you get the littlest, tiniest piece come off. Okay, tiny. Now, when that tiny piece comes off, you still bleed. Thus why you will see bleeding come out of the vagina. However, if it's the tiniest little piece, the rest of this is secure. Baby still gets plenty of food. You don't bleed so much that it's a medical emergency for you, and then that clots off, and then you're all set. So that's why that's the difference between the two. Now, if there is a separation going on, that is a lot more significant than a subchorionic hemorrhage. The hemorrhage is underneath, and you have all the rest of this placenta feeding the baby. And while a partial placental abruption could only be a little tiny piece coming off, so again, you have all this feeding the baby, we worry that the rest of it will come off. So that's why we are kind of concerned about that. And that's why we end up monitoring you more carefully and talking a little bit more in depth about that. Hi, Nancy. Okay, so how long into my pregnancy can I find out the sex of the baby? Honestly, nowadays, as soon as you get the first set of genetic testing, you can find out the sex of the baby, which is usually like around 12 weeks. We have a video on genetic testing that you can check out. But when you get that blood work, so when I talk about like RH incompatibility, this is where your blood type doesn't match your baby's blood type and you need a medication called Rogan. Part of the reason why that's necessary is that we now know that your baby's blood is actually going to circulate in your blood. So it used to be thought that it was kind of like completely separate systems, but this placenta that's feeding your baby and is basically kind of genetically related to your baby, it didn't exist in your body before then. It's literally attaching to your body, right? So there's a lot of circulation back and forth of your blood to the baby and the baby's blood to yours. So now what we figured out is we can test the blood, and that's how we actually get the cells from your baby in order to test for these genetic abnormalities and stuff. Well, while we're in there, if we're testing genes, right? So part of the genome is the XX chromosome for a girl or the XY chromosome for a boy. So nowadays, a lot of people will actually reveal, when they reveal that they're pregnant, they will also actually have their gender reveal at the same time. They'll take their genetic test results. A lot of people now wait for those to come back. And then that's when they announce to their family, and they can do everything all at once, which is kind of cool. So yeah, as soon as that. And it's kind of, I really like it better because I will tell you guys, and at this point, genetic testing is so much more common, but in my career, I have actually been in the room where people have had an ultrasound that told them what type of baby they were going to have, and we delivered the opposite. So it has happened, at least for me, to see that. And that's always an interesting experience. So you should be able to find out pretty soon. Okay, so we had a question on my superfoods video. So I have a couple videos on like diet and stuff. One of them is some superfoods that you can eat during your pregnancy. And it said, what about grilled hot dogs, sausages, and links? So you guys have to be careful with certain foods during pregnancy. And some of them are like undercooked or raw meat. That's why you're not really supposed to eat sushi that much. And you'll also have to worry about hot dogs and deli meat and other things like that, because a lot of these cured meats and cheeses, they're not completely cooked through, and they can contain different types of bacteria that are harmful. Now, a lot of people are like, they kind of like don't completely understand why. So let me explain. You are immunocompromised when you are pregnant. So just like I just said for Nancy, your baby's blood is circulating through your system, okay? Your baby has their own unique DNA. That is not your DNA. It's part of your DNA, but it's not all of it. So for lack of a better way of putting it, your baby is a foreign invader. And so if our immune systems when we were pregnant are completely fully functional, our immune systems would try to attack our babies. And a lot of people's immune systems are very hyper alert and will cause some different like damages and stuff to babies. That's one of the things that they're looking at for possible causes of miscarriages. Like, is it an immune system response that's causing the body to attack the baby and therefore cause a miscarriage? So our immune systems naturally kind of come down and calm down when we're pregnant. And this is to allow the baby and the pregnancy to proceed and to be healthy. As a result, pregnant women get sick way more. A lot of women get very frustrated because they get sick and then they can't take any cough or cold medicine. And one of the things they'll say to me is they'll be like, I never get sick. Why am I sick now? And it's because you're immunocompromised. Now, this is one of the reasons why we also stress getting vaccines when you're pregnant. It's because if you think about some of the populations that were targeted for different vaccines, what do we say? If you're at high risk, this vaccine will help reduce like your risk of hospitalization or death. Well, the same thing is true for a pregnant woman. We're trying to encourage vaccines to reduce her risk of hospitalization or death. And I don't mean to sound scary, but for those of you who are trying to make the decision about getting different vaccines, I have taken care of women with both COVID and with the flu that have not had favorable outcomes in the hospital. And that's because they were not vaccinated and they got more serious disease. So it does happen. And so when we come to these uncooked foods, well, we can all eat something and get food poisoning. But for a pregnant woman, that food poisoning can lead to stuff like kidney failure. So that's why we're trying to avoid a woman eating something that has a higher risk of having a parasite or a bacteria in it. It's a running joke in my house about how I actually wash romaine lettuce. So I'm really, really, really picky before we have a salad about washing romaine lettuce. And that actually comes from my time in the hospital, because I can't tell you how many women we got in that had like kind of like a mysterious stomach bug type of thing that had some kidney issues also. And 9 times out of 10, when the doctor, the maternal fetal medicine, which is the high risk doctor, would come in and talk to the patient, they'd say, hey, did you recently have a salad? And so often they would say yes. And then we would kind of do some testing, and it was almost always E. coli. E. coli is a bacteria that's found in feces, and oftentimes it is found on lettuce. It's very common that you'll get E. coli infections from lettuce. But if you wash it really well, you're fine. But if you're going someplace like in a restaurant or something, maybe it's not washed as well. Or if you're at home, maybe you're not always washing as carefully. And you don't really think about it because most of the time it never occurs to you. You never have an issue. A lot of people can fight E. coli infections off and never know they had it. But pregnant women aren't so lucky. So that's why I will tell you guys, it's very important to have food safety, to be very conscious. Don't be a germaphobe, live your life, but just understand you have to be a little bit more careful. And I would tell you, don't eat salads out in public. Make sure you have control over your own lettuce cleaning. So I hope that helps with that. Moving right along. Any of you guys have questions, please feel free to put them into the chat. Let's go on to antibiotics, since we just answered an infection question. So a doctor prescribed me metronidazole, Flagyl 500 milligrams, and I'm 9 weeks pregnant. Should I take it? It's an oral pill. So metronidazole is one of many antibiotics that may be prescribed to you as a pregnant person. So I just told you, you're at higher risk for getting an infection. Well, we need to take care of infections right away if you're pregnant. Like, this is so important. One of the leading causes of miscarriage, preterm birth, and stillbirth is infection. We're talking bacterial, viral, fungal, and oh my gosh, yeast type of infections. Oh my gosh. So it is extremely important that if we find an infection, we get it treated well. Urinary tract infections are one of the most common infections that we will see. Those are usually treated with antibiotics because they are bacterial. Antibiotics treat bacteria. Flagyl is commonly used for a couple different STDs, including something called bacterial vaginosis. Bacterial vaginosis is actually not a sexually transmitted disease per se, like you would imagine chlamydia or syphilis. It can be caused by a pH imbalance that's often due to sperm entering the vagina. Sperm can like change the pH balance, and then you get an overgrowth of a certain type of natural bacteria that causes this infection. And Flagyl is often the treatment that we use for it. Now, we are very careful about what we prescribe to pregnant women, but if you're ever worried, feel free to ask, what are the risks versus benefits? What if I choose not to take this antibiotic? Go to your local pharmacist. Pharmacists have specialized training in medication, including their safety profile for pregnant women. So these guys can often tell you about it. If you are going to take your medication, you need to take it as prescribed. So this is also something I'm very passionate about. So you're pregnant and you don't want to put anything into your body because you're worried about the baby. Well, the nice thing about antibiotics is a couple doses and you start to feel better. So what 9 times out of 10 will happen is a pregnant woman will come in with a treatment-resistant infection. And when we ask her, did you take all your antibiotics? She says no. Because when you start to take it, you feel better and then you stop. But think about the bacteria like an army, right? And so when you start taking the antibiotic, it starts killing off some of that bacteria, right? But the guys in the back, they're building a wall and they're paying attention and they're figuring out the game plan. So then you stop. But these guys, they build reinforcements that'll block your antibiotic and then they call in reinforcements. And a day or two later, you're sick again and you feel awful. So then you're like, oh, I better take the rest of that medication. But remember, now there's a wall and your antibiotic won't work. So now you got to come back to us, and now we might have to give you stronger antibiotics that have more risks. So it's very important if you decide to take any of these antibiotics, which I encourage you to do if a infection has been identified, take them as prescribed. As for metronidazole, we commonly use it even in the first trimester. It's usually treating one of the sexually transmitted diseases that can lead to uterine infection and miscarriage, and it is generally speaking safe to use. There's no evidence of any types of birth defects or anything. I'm Dr. Samantha, the maternity mentor. For those of you who are joining us, please feel free to put your questions into the chat. And for those of you who stick with me until the end, I will give you a sneak peek at tomorrow's video because we are back and we are putting out videos again after our brief stint because of COVID. So my next question is on preterm labor. I am 28 weeks pregnant and my cervical length is 2.1 centimeters. I am currently taking progesterone. I am scared about preterm birth. Okay, so we talked a little bit about cervical length also. Once you're starting to get to 2 centimeters or less, that's where we start to consider it a short cervix, okay? Short cervix. So, you know, you have your longer cervix, and then what they're talking about is it's just getting shorter. And it's getting shorter most likely because what's happening is, so this is your cervix. As you have contractions, it starts to pull the cervix apart, but it also starts to efface and thin out, right? So as this is happening, you can see the cervix is getting shorter. And so that's most likely what is happening, which is causing the shorter cervix. And that can lead to preterm birth. So it's one of those things that we monitor. However, 2 centimeter cervix is still pretty decent. I definitely don't want anybody to have a preterm baby, but I think it's important kind of to address gestational age and to help give some reassurance. You're going to want to do everything they ask you to do. Make sure you're getting all your prenatal care and stuff. At 24 weeks pregnancy, a baby can live outside of the with medical assistance. It happens more and more. There's actually cases much younger than that are able to survive outside of the uterus. However, we want to deliver your baby as close to 40 weeks as possible. But by 28 weeks of pregnancy, a lot of these babies can be 2 to 3 pounds. They are not able to directly bottle feed or breastfeed yet, but they are able a lot of times to use tube feeding very successfully and very minimal respiratory help. Respiratory is breathing. So a lot of these babies are actually able to use almost like a CPAP machine, which is what a lot of people use at night for sleep. Every day that goes by when you're pregnant is a day that the baby gets bigger and stronger. If you are having any symptoms, go to hospitals. I really encourage this. Women feel stupid. They're always feeling like, oh my God, I'm probably worrying too much and probably this and that. I can't tell you how important it is that if something is going on, we see you sooner than later. So one of the things that we'll give people is steroid shot. And the steroid shot is designed to basically ripen and strengthen the baby's lungs so that if you do deliver, the baby will be stronger and able to breathe better on their own. Every hour that you have steroid shots in your system is an hour that the baby is getting stronger. And so it is so important that even if you got there 3 hours before you delivered, 3 hours is so much better for us than 1 hour. One of the other things we give preterm birth is we give them magnesium. So magnesium is this fantastic thing. It actually can stop your labor, but it also will protect the baby's brain and we believe helps reduce the risk of certain birth complications. So again, getting in there sooner versus later is so essential to a better outcome if you are having a preterm baby. So don't ever feel silly or stupid if you need to call or if you wanted to just make sure things are right. If your body tells you it's not feeling well, then listen to your body. So, all right. So Shamika, I hope I said that right. I'm getting induced and I wanted to know how long can an induction last? Dun, dun, dun. That is one of life's mysteries. Okay. So I'm going to tell you, it depends on your provider. So let me tell you what I feel is a good induction. We have a video on Cervidil, which is one of the induction agents that I really, really like. So inductions can last anywhere from 24 hours to actually really 12 hours for kind of not so great providers to 5 days. Okay. In my opinion, the longer the induction, the better, depending on your cervix. So let's go. Cervix, long, thick, and closed. If you're about to have an induction and your cervix is long, thick, and closed, this is a cervix that's not ready to have a baby. So when you start having contractions, you have this long, thick, and closed cervix, and what those contractions do is they start to pull it apart, dilation. They start to efface it. That means thin it out, and you keep going, okay? So when you have this long, thick, and closed cervix, we need to get it ready. And your cervix, when it's not ready, it actually kind of feels like your fingers. It's actually kind of this texture. And what we need it to feel like to make it like super ripe, it's almost like a squishy, I'm trying to think, like a squishy sponge, like it's very soft, okay? That's a cervix that's going to dilate really, really well. Cervidil is a medication that what we do, it's kind of like a flat tampon and it's got a medication that will ripen the cervix. So you can actually lay it up against the cervix inside the vagina and you leave it there and that medication absorbs into the cervix and it changes that kind of like feeling. Because when we give Pitocin, what Pitocin does is it causes that contractions that cause the dilation. Well, it's going to make it easier for Pitocin to do that if it's already ready to go. And that's what Cervidil does. Now, Cervidil is put into your body every 12 hours. And really, people can need Cervidil like for 2 whole days before the cervix is really ready to go. If you have a provider who's rushing to get your induction done, then what can happen is sometimes you'll hear about people who come in and they come in at like midnight and they're given like Cytotec, which is a pill they can put in your cervix to kind of get it to dilate. You're given a little bit of Cytotec, and then in the morning they come in, they break your water, they give you like Pitocin, and if you haven't delivered by 5 p.m., you're having a C-section. Those are the worst. Because if your body needs an induction, you're most likely going to need some time. Now, One of the problems is people don't realize that the longer it takes, as long as the baby's doing well, the better it is for you and the better your chances are of having a vaginal delivery. Since they don't know that, they get very antsy and very tired. They will really just not be, they get very frustrated as well. Your chances of possibly having a vaginal delivery versus a C-section is allowing your body to be as ready as it can be. Now, if you have any time ahead of time, I don't know when you're getting induced, you should ask your doctor if you can start using a breast pump ahead of time to help stimulate contractions, which can help ripen naturally at home and help get you ready for actually the induction and make it even more successful than that. So hope that answered that question. Any of you has questions, or if you guys have follow-up questions, please feel free to put them into the chat. Now, the last set of questions I had, I have two sets of questions. The next one, I'll do the water for formula. Can I switch my baby's formula cold turkey, or do I have to transition them off slowly? Also regarding boiling tap water, I noticed that there are white things floating or a layer of film on top of the water once it's cooled. Is it safe to feed my baby this water? I stopped and started using bottled water instead. You're welcome, Shamika. So, number one, can you switch your baby off of formula cold turkey, or do you need to taper? Nope, cold turkey. Pretty much nobody does that whole taper thing unless you're lucky enough that your baby has no issues with formula, and you're like, let's say you're going from Enfamil to Nestle, like Good Start, right? And you're just doing that because you got like a coupon and it's saving, and your baby's like one of those rare babies that's like totally cool with anything, and you're just trying to use up. You could like, I can't kind of mix it up, but otherwise, no. Most people are having to switch because the baby's not tolerating the formula that you're using, and therefore you just switch it over. Okay. And I always encourage people to save any formula that you might have left over. Believe it or not, you might have a week or two where the baby's tolerating the new formula, and then all of a sudden, they're not tolerating it, and you want to go back to the old one. So don't really get rid of stuff unless you think it's going to be used improperly, or if it's expired or something, then get rid of it. Now, white stuff in the milk, right? So that's actually probably because you have hard water. So some people's water have minerals in them. And so I don't know if you guys have ever heard of water softener, but people have to add this because the water is too hard, and it gunks up your shower head and other things. When you boil hard water, what oftentimes will happen is as it dries, like you'll see this powdery white stuff, that's actually calcium. And so calcium is there, and that's what you're seeing. So, I have seen this before. Most people don't tend to use it because, amongst other things, you have to be very careful with babies' electrolytes, and calcium is a significant electrolyte that can actually affect cardiac rhythm. I'm not going to say that it's the worst thing in the world for the baby, but you probably would want to stick to something else because you don't know exactly, what's going on with your water and how prevalent those minerals are. As the baby gets older and older, though, that the baby will be fine to use your water. So I would say once you're hitting like 9 months or so, you should be fine. Hello, my question is, why can't you give a toddler formula after they are 1 year old? You can give a toddler formula. I think what you're asking is once they turn 1, you have been told they can't use a toddler formula, and they can. You can absolutely use toddler formula after they're 1 year old. Before 1, you need to use an infant formula. Now, maybe you're referring to some of the stuff out there right now, which is talking about like how a toddler formula isn't needed. Does it affect them in any way? So it does not. It's basically almost like gosh, I don't want to sound like bad, but it's kind of a waste of money. So once the baby turns 1 year old, they are ready to eat regular foods. Like if they aren't already, they can pretty much start eating everything that you eat. And now we do recommend cow's milk because cow's milk has certain proteins. So the biggest thing that a cow's milk does is it's providing certain proteins and fats that are needed for the developing brain. A lot of those toddler formulas